If you feel like you've really been struggling with your health and your wellness, maybe you're struggling with energy, changes in your mood, more fatigue, more anxiety, more psychological symptoms, this video is for you. And I want to start with a story of a patient of mine. And this is a woman who was in her mid-40s, and over the previous year, she'd really noticed some significant changes in her health. And see if you can relate to any of these. She was gaining weight with more fatigue and more anxiety. But she was also noticing some significant changes, like in her hair, the way that her mind was working. Her belly wasn't feeling so good. She was having gas and discomfort, alternating between, constipation and diarrhea. This is not something that she was familiar with. But what scared her the most was the fact that she was noticing some pretty significant depression. And she had struggled with depression when she was a younger woman and was really fearful about going into another dark space. And she did what would be expected. She went to go see her primary care doctor. But I'm going to tell you up front that she saw 3 doctors and none of them were able to determine what was going on in spite of their good intentions. She first saw her primary care doctor, who spent a little bit of time with her, did some basic blood work. I think he checked a basic blood count, maybe some chemistries. I think he got a TSH for her thyroid, which was normal. And he gave her referrals to go meet with a psychiatrist and a gastroenterologist. Now, first, she went to the GI doc, who didn't even lay a hand on her. He did no additional testing. He only put her on proton pump inhibitors. Those are the little purple pills that suppress acid in the stomach. Told her to come back in 4 to 6 months. And if she wasn't better, he would do a gastroscopy on her. He would put a scope into her gut and see what was going on. And then she went to her psychiatrist. And similarly, this doctor spent about 10 minutes with her. And his only recommendation was some antidepressants. And she just knew that that wasn't what she needed at this time. And, here's the sad thing, is that nobody was able to address the one factor that was contributing to all of these 3 different diagnoses. So by the end of this video, you're going to understand how a high cortisol state from hypercortisolism, from increased stress, can contribute to all of these diagnoses. And I'm going to share with you the 3-step process that I've used with hundreds of patients to help to turn it around. My name's Scott Resnick, and I'm a conventionally trained medical doctor. I've been doing functional medicine for about 15 years. And I'm making these YouTube videos to give you guys the tools so that you can turn around all aspects of your health without using conventional drugs, and to try to give some order and some process to the complexities of natural healing. So to start with, what I want to do is I want to first remind you what cortisol does. Remember, cortisol is our primary stress hormone. It's made by the adrenal glands. But many of us believe that cortisol's primary job is to get us away from a tiger, to help us survive a fight, or run away from a flooding river. The truth of the matter is that cortisol's primary job is to raise our body's blood sugar. And it does this at the expense of everything else in the body. So when somebody's cortisol level is high, they break down their muscles to liberate amino acids. They break down their bones to liberate calcium and magnesium. High cortisol levels actually cause a measurable amount of shrinkage in a part of the brain known as the hippocampus, which is responsible for higher order processes. And the other thing that happens is cortisol diverts blood away from our gut. I mean, this makes sense because our greatest stressor is not running from a tiger, it's not having food, which is why cortisol is melting and breaking down our body. So if we're not eating anything, it really doesn't make much sense to be sending a lot of blood flow to our gut. Now, the first thing that this patient and I did was to obtain a 4-part salivary test with DHEAS. Now, these are 2 hormones that are all part of the steroid hormone cascade that are so important to look at collectively. And I've said it over again in this channel that if you want to be looking at your cortisol levels, you cannot just utilize a single serum cortisol level drawn at 8 o'clock in the morning. That's not going to tell you what's happening with your cortisol over the course of the day. My preference is to do a 4-part salivary cortisol test and add the DHEAS as well, because that's going to help you to understand if your body is really moving to a catabolic state where you're breaking down a lot of your tissues to basically stay alive. That's what was happening with my patient, because with her elevated cortisol levels, she was promoting changes in her brain and her cognition, actual measurable changes in her brain architecture. She was causing her muscles to break down, and typical to cortisol's action was retaining water and increasing some of her fat supplies as well, in spite of eating healthy. And the other thing is that she was having significant symptoms with her gut. So what do? I told you I'd go over a 3-step approach that I've used with many of my patients. So we've already gone over one of the first things that I would do, which is obtain a 4-part salivary cortisol test. I think that this is the best way to see what's going on with our adrenal function. Now, the next thing that we did was to change her eating habits. Remember earlier in this video, I explained that cortisol's primary job is to raise our body's blood sugar. So the first thing that you guys want to be doing is avoiding blood sugar spikes. And we do that by taking out all of these simple carbohydrates from our diet. The more that we can consume, like, more foods that have a lower glycemic index, more proteins, more fats, more vegetables that have fiber in it, this delays the transit time through our gut and also improves the amount of energy that we get from those foods. But while we're talking about foods, it's important to recognize that there are some processes in the body that require a little bit of ceremony. We need stomach acid to help to break down our proteins and to help to liberate our minerals from their salts. Remember, one of the medications she'd been put on was a proton pump inhibitor that specifically blocks her stomach acid. Ironically, she needed to have probably a little more stomach acid to help with her digestion. The other thing that you can do is around meal times is create a degree of ceremony around your eating. I mean, take some time to prepare your food, smell the food, put some candles, maybe use some cloth napkins on the table, because this is going to activate something known as the cephalogastric reflex. And this is a reflex between your brain and your gut that effectively helps your gut to work better. So when we're under stressful situations, when we're not taking time to really appreciate and digest our foods, our body doesn't work as well. And the last thing that she did was she engaged in some mind-body practices. And I know that this sounds woo-woo to so many people, but I can tell you that there is good science to support the fact that with as little as 1 to 2 deep breaths, we can begin to alter something known as our heart rate variability. Deep breathing increases heart rate variability, and increased heart rate variability is directly associated with increasing our parasympathetic tone. Remember, the parasympathetic nerve, the vagus nerve, is our rest and digest nerve. So we can begin to activate that nerve with just a little bit of, basic breathing. Now, the other thing that I recommended to my patient was that, she start to do some other mind-body practices. These are things like, meditation, Tai Chi. I mean, even a walk in the park can be beneficial to help to suppress that cortisol response. She had seen 3 doctors. She didn't get one diagnosis, and not one of her doctors had thought to measure her cortisol levels. And once we realized that she was in a high hypercortisol state, everything else began to make sense. And if you follow the videos on this channel, you're going to learn how not only does cortisol melt down the body, it affects the way that your thyroid gland works, the way that your insulin works, the way that your heart works. Cortisol is the master ringleader of all of the hormonal systems in the body. So what to do? If you're interested in knowing where you stand from a functional health perspective, I've put together a really cool 2-minute, 5-question self-assessment that I call my functional health assessment. It's listed in the description below. That's going to give you a good idea of where your health is from a functional standpoint, because when you know where you're starting from, then you can know where to go. And I'll see you there.